You know what you're doing?
No.
So you had to. Well, don't start it on there yet.
Well, it's not even.
In a hard chair.
How come this part doesn't seem? Do I want to do webcam? No. I want to go live.
Are you like live right now?
No, I'm not.
So. Yeah. What does this say? Start what?
Trying to get everything.
Do all that.
Oh, I know.
Sometimes it's hard to get those texts. Like, yes. Well, I'm glad we got our codes. Yeah.
No.
That's 72 in here.
Well, you go to the other one, and you have to hit. Oh,
See, I am straight.
did that before.
No. Should I stop this?
Yeah, stop this. You have to have that streaming first, and then do this. You know.
The process down.
How do you even get out of here?
Really? I had laid in an hour on that large whiteboard. Mainly because I wanted to take a picture. But then as I was moving it from room to room, I said, no, this is not very smooth. Yeah, it's just too big, it just almost fits in the corner. So I'm gonna figure out, so I had this little plug. And I decided to use it with a longer
Oh.
this
Says you're live now.
balls in there, and then the strings just come off in the center. Yeah. It worked perfect. And then, so, yeah, so that's been, working real smoothly. So now my next goal is to be able to figure out how to do the heel.
Yeah, so you can't hit that until you're ready to actually start
Without
the
taking
streaming.
off the
Because now you're like live right now.
magic loop. Yeah.
She's fine.
So I've got the first half done. Have you ever done the socks with, reels, the short roll?
One lady
You know,
didn't pay, so
Oh, it's fine.
I don't like. How do I ring that up?
Oh.
Gave her a coupon.
Anyone there in YouTube world can hear me. We'll be starting in about 5 minutes.
Does it have a mic in it?
There's still a mic in the
Oh, okay.
camera.
What do I ring this out as?
Oh, so go to F1 and type in Entero.
Kind of logical, except for the twin stitch.
And then what did you want? Yep. And then F8.
Figure that out.
Put it under her name.
Yep. Perfect.
Sample. Starting practice. So we'll see what happens. No. The reason why I'm doing this is I'm trying to plus my stitch. So I have all this yarn that was perfect. My sock. Some of it already. Well, I don't know.
Look what I wrote.
One of the reasons why things are not going to get to, you're not supposed to, because it will create a little crisscross on top of the yarn. Oh, okay. And then the other thing is I didn't, literally I had mounted, and if I turn to see, thank you.
Yeah.
If,
What's your name?
Leanne Fuller? I could pull it from the wrong direction. Or if I load it from the wrong direction. There you go. Thank you. This basket. Well, sure enough, out of four out of 8 balls have baskets. Then you're stuck and it looks terrible. But then I had 3 different kinds of yarn. One was that, they rolled up, I used for that sock class. I thought it was nice, except that it has segments that it has no lock in it. It's a little strange. And so you get this little section of very commonly used yarn in West Bend. Ladies at Bus Stop Panera yarn group. Just loved knit pick stroll. And so I had just this one yarn ball with two. I thought, well, I'll give it a try. Oh, does that feel good? This is a beautiful feel for the yarn that you're knitting. It has long.
Did you hand out the handouts? Do you even know? No.
I just couldn't believe it. So one difference.
It's a great question.
Oh, boy.
And I had this other one.
Just one. Yeah, I made a lot of extra copies.
I see that. Are you doing your other camera or no?
No.
Is this thing gonna die?
You know what? I am going to do the other camera.
I mean, like, does it need to be plugged in while you're recording?
No, it's a really long battery. So I think we're good. Testing, 1, 2. Testing, 1, 2. Let's see how that's working. Testing. Welcome to MD Custom RX. Mic check. That sounds good. Maybe go up a little bit. Welcome to MD Custom. Mic check. 1, 2. There we go. How many more minutes do we have?
3.
I might
Is
go.
your mic set up?
Yep, it's recording.
3 people aren't here yet, so.
Oh. I usually like to have this side by side. In case anything goes haywire.
Mm-hmm. Do you want to know if it stops recording?
Why can't I make this small?
Just leave it, don't mess with it.
I know. Oh, that's because it's the small little bit. Okay.
You are getting the other camera?
2 minutes.
Listen to that. Hi. What's your name? Here's your coupon, and then here's a handout. There you go. Aren't you gonna move that laptop too?
Yeah, but just, it's an easy one.
Yes.
Is it? All right. Thank you.
You're welcome.
Oh, it's got to be, yeah. I know. Okay. Good. Oh, Dane's chiming in. Trolling the chat room. All right. Welcome. Everybody ready?
Yes.
All right. We're live streaming it and recording it, so you can go home even tonight and just rewatch everything again if you want to. So you don't have to frivolously write down notes, but if you want to, that's great. I have about an hour of material. I can get as long-winded as you want. I have nowhere to be tonight, so yeah. I think if I'm home by midnight, we'll be good.
That's my bad.
I'm gonna be really tired by then. But. So MD Customer X. So, this is more for the patients that are chiming in on YouTube now. But we're about optimal health. Optimal. Let me say that again. Optimal wellness. Let's talk tonight. So, which sounds a little bit contradictory because we're a pharmacy, and in the traditional pharmaceutical world, see a lot of nodding heads already. That going to the pharmacy, I must be sick. I'm just going to be put on a bunch of medication and more medication, and I live that life. I will confess, I was Walgreens intern at the time. Spent 2 years at Walgreens, and then probably, let me think about this, the first 6-7 years of my pharmacy career as I'll call it a traditional pharmacist, just dispensing regular medication day in and day out, billing insurance, all that kind of good stuff. But I did know, here's where I'm going to get long-winded. I'm only on this first slide and I'm taking up probably too much time. But my point is MD Customer X is a pharmacy about restoring health, restoring wellness. I want to actually get you off of medication, not put you on it. So if you came here to learn about, I have to be careful. I don't want to mention names because I'm being recorded, but bisphosphonates or traditional medication, you came to the wrong class. So you're not going to learn about that tonight. So, all right. Which leads me to my medical disclaimer. So I got to be careful on again what I say. I don't want to put too much of how I feel into this, but otherwise I might get in trouble. So I'm just going to read this out loud mostly for the people at home, but this information is presented is based on experience and the training of me and the scientific information that's currently available. The suggestions in this presentation are not meant to be substituted for medical evaluation or treatment, and or treatment. I do not recommend changing or adding medication or supplements without consulting your personal physician. And I, the presenter, specifically disclaim any liability arising directly or indirectly from the use of this presentation. So, okay, got that out of the way. And, oh my gosh, technical difficulties already. Let's see. Does that help? And that's another medical disclaimer. If you've heard my presentations before, I apologize. I do tend to get ahead of my slides. Come on in. Yeah. We didn't even get to the content yet. I'm still yapping about who we are. So we're going to discuss basically what's on this slide in great detail tonight. So right off the bat, the gut microbiome affects bone homeostasis. So what does that even mean? So gut microbiome, all of the bacteria, viruses, anaerobes, all the different bugs that are in our GI tract. Even we have a whole microbiome, a whole slew of fungus that are beneficial to our GI tract, which might seem, again, that might seem like the wrong thing to say, but there's actually good good yeast in our GI tract. But all of that collectively we call the gut microbiome. All those just different bugs and viruses. So they influence the immune system, which if you influence the immune system through good bacteria, you're actually influencing bone health, which we'll get into that. Modulating our metabolism. We'll talk a little bit about just having good bacteria will help you produce more vitamin K2, which that's going to be one of the key take-home points tonight. But having good bugs, the good bugs produce the vitamin K2. Now we have K2 to do all the work. So do we have to go out and supplement with K2? Not necessarily. We just got to eat the right fiber to feed the right bugs, then they will make the K2 for us. So, changing hormone secretion. So what does that mean? So actually our bones, I'll show this in the next couple slides here, but they actually produce melatonin. You normally think of melatonin for sleep. It's produced by the pineal gland in the brain, but I'm going to show you studies tonight, or a study that talks about melatonin secretion and how that influences bone health. So if we don't sleep well, we're not producing this melatonin out of our bones and not stimulating bone tissue. So just something as simple as that. And then impacts on the gut-brain axis. So we're just going to talk about having good bacteria. It's going to influence the brain. The brain's going to then help to influence other cells directly related to bone tissue. So we got the gut-bone axis. Those two are connected. The gut, the bacteria, helping to build bone. Then we also have the gut-brain axis where the gut, the bacteria, those same bugs or similar bugs are then sending messages back up to the brain going, well, let's turn on bone resorption. Let's start breaking down bone. Or maybe it's going to send signals to the brain saying, let's start building new bone. So we have a fracture, we have to bring more resources into that broken bone and start fixing it. So there's a lot of different interplaying things going on here. So I try to boil this down to where we're going to be going for the next hour. So epidemiology, there's a huge issue with this going on. We're going to nerd out a little bit, or I am, with the physiology and getting out to like what cells are involved and so on and so forth. It is important to kind of know who the players are of the game, because once you know the players of the game, then you can play the game. So that's what physiology is important for. Diagnosis, I have, I think, one slide on the DEXA scan and what that means and so forth, and where do you fall in the spectrum. Clinical importance, we're going to spend a good deal of time with that. The gut-bone alliance, so how is the gut for the bones or against the bones? If we have a healthy gut, what does that mean? If it's unhealthy, what does that look like? And how does that influence bone health? Some simple lifestyle recommendations like just lifting weights. We'll talk about that. You can't, in my opinion, you cannot walk yourself to good bone health. If you walk 10 miles a day, that's great. It's good for cardiovascular health, but it's really not going to build enough bone in your bone tissue or in your hip or your spine for that matter. Keep doing it, but you're going to have to put some weight resistance, weight-bearing exercises in there. And then therapeutic plan suggestions, we're gonna talk about some supplements, so obviously lifestyle comes first in my opinion, but then let's talk about, okay, we can't eat enough natto, for example, which is fermented soy products out of Japan, you know, who even likes natto? I have yet to meet anybody that even likes that slimy stuff, but let's take a supplement instead, so we certainly sell those here, so we'll look at some therapeutic plans that say, okay, I'm doing all these lifestyle things, modifying my diet, so on and so forth, but I need some more vitamin D, because I'm not gonna sunbathe naked on my roof every day between 11 and 2, so that's just not gonna happen, so let's just take a supplement. Well, some people might. All right. And then you all have, for those that are here in attendance, have a action plan to take home with you too. So I will try to link that handout somehow to YouTube, somehow. We'll figure that out. I think I'm hitting some wrong buttons here. I gotta be careful. There's like an off switch button right below. Yeah. All right. So some of the issues that are going on here with bone health. So we don't have like, I don't even know. Breast Cancer Awareness Month, is that this month or?
Yes.
Yeah. Okay. See, but maybe, in my opinion, maybe we should take a year off next year and make it Bone Awareness Month. And I'll tell you why in a minute here. So some things we probably already know a lot of these things. Lifespan increased by over 30 years in the last century, so we're living longer. So our bones have to last us longer, hopefully, because we have 30 more years to, more treads to put on there. Lifespan has increased at an extreme cost, and I think we all know that if we're following the news or just aware of what's going on. I see hospitals being built like everywhere. Like, where the heck is all this money coming from? Oh, they've got plenty of it. Because we're living longer, they're keeping us around, and I say they, I mean, I'll let you decide who the they is. I don't want to get in trouble. They are keeping us around longer, but that's coming in at an extreme cost. They're just not making us sick enough to die, but they're just well enough to keep us around to keep taking our money, right? So healthcare services in 1960 was 5% of the GDP, which is around 27 billion, which that, even in 1960, that sounds like a big number to me. But then fast forward to 2019, and now it's 17.8% of the GDP. So now we're at $3.8 trillion. I can't even, the number doesn't even, I can't even make sense of that number anymore. Cost of pharmaceuticals has increased 10 times over the last 60 years. Even in my 20 years as a pharmacist now, I've seen pharmaceuticals go up enormously. It's just ridiculous. I could, buy a bottle of metformin, for example, for probably $5 for 100 pills, and I don't know. I didn't look at what the bottle of metformin is today. Probably even $25. If that would be a cheap price for that same medication.
Look at insulin.
Insulin's going up, yeah.
Yeah, and insulin's outrageous.
Yeah, everything's going way up, so, especially pharmaceuticals. What are we gonna do about it, right? This is not a sustainable model. I think I'm the only one that shares that. 23 million Americans have bone loss, so that's a huge number. Every 30 seconds, someone in the world breaks a bone because of osteoporosis. That's in the world, not just I expanded that out now. But I would argue that's mainly in first world countries. Talk about why that is. 50% of women over 50 years old and older have significant bone loss. For women only, your risk of bone fracture, here's where we're talking about Breast Cancer Awareness Month. Your risk of bone fracture due to osteoporosis is equal to your combined risk for breast, uterine, and ovarian cancer. That is scary. So of the, I can't remember, I think there's, don't quote me on the numbers here, but out of 300,000 fractures every year in our country, 70,000, so whatever percentage that is, of those patients will die within the first year of having that first fracture. So 70,000 deaths due to having a bone fracture in that first year, so that's scary. Women over 50 years old, your risk of dying from a hip fracture is similar to your risk of dying from breast cancers. Again, we don't have a osteoporosis awareness month, or a ribbon, or a walk.
They
For
said your
jewelry.
volume's low.
low. Fix my volume. Nobody go anywhere. I'm trying to do this. Was it a comment from
The line.
the live feed? Okay.
And it's been like hovering right here.
What's that?
Can you like the
Volume. That's maybe this is a little better. How's that?
You were like waiting.
Oh, okay. Now I'm. Ooh, I might be a little bit too much.
Yeah.
Let's tone it down just a little bit. How's that? Good? Better?
Yeah, but
Okay.
yeah, it's fine.
Just give me like a more and it's alright.
I think you're fine
Usually
now.
usually it's the other way around.
Yeah, no, it's good now.
Good now, okay. Real quick diagnosis. So again, I'm not a doctor, so I can't diagnose you anyways, and nor do I have a DEXA scan. But that's how if you go to your traditional doctor, they're going to do a DEXA scan, a glorified dual X-ray, yada yada, whatever. So perform a bone mineral density test using the dual energy X-ray machine. And if your T-score is, we'll look at the next line here, let's just actually jump to it, but if you have a normal, we'll call bone mineral density, your T-score is going to be, I'll say 0 or above is fine, which is very unusual, or it's going to be like between 0 and -1. Then you're okay. But then if your bones are starting to weaken, if you get a T-score between -1 and -2.5, then you're diagnosed as having osteopenia. So your bones are frail, but not frail enough. So it's like wishful waiting. Like let's, hopefully we do some lifestyle modifications. It should be a wake-up call. Like we got to put a plan together to start building some bone tissue. And then severe osteoporosis is anything -2.5 or less than that. So it's basically the more negative the number, the worse off you are. And that could be like, they'll do these scans in the hip, right? They'll do it in, where else do they do it? Spine, right in the back. Do they do it in your wrist?
We'll do your femur.
Your shin. Usually I'm thinking hip and spine. Remind me, if we have time, at the end I'll tell you a story about a lady about the bone density in her spine. I might forget to talk about that. But risk factors, there's a ton of them. If you're above 50 years old, if you're postmenopausal, that's a huge risk. We deal, again, you know this pharmacy by now, we deal a lot with postmenopausal women here. So that patient, that woman that's 50 years, or postmenopausal and over 50 years old, they are, in my opinion, and the research shows it too, at extreme risk for osteoporosis, because once your estrogen starts to drop, it's perfectly correlated. Your bone density starts to go right down with it. I don't have a graph on that, but there's tons of research out there that shows as soon as that woman hits menopause, bone health goes way down. So my point to that is we have to do everything that we can between a woman 20 years old, and I would even say even younger than that, but let's just say 20, 15 years old, all the way up through menopause, and do everything we can to get their bones as strong as we can, because once they hit menopause, that's where it's a slippery slope and they start to lose that density, potentially. So let's try to get the bones as strong as we can before we hit that menopausal age. Low BMI, you just don't have enough, the earth isn't pulling, you look at the scale every morning, you're only 100 pounds compared to somebody that might be 200 pounds. So that 200-pound person, the gravity's pulling more on their bones, and so, yeah, you get that point. Family history is not necessarily genetic with poor bones, but it's in that inherited lifestyle that we might not be eating as well. We might be eating an acidic diet. We don't take exercise seriously. It could be all kinds of different things that way. I just talked about, inactive lifestyle. So just not doing anything, not moving around at all. Smoking doesn't help. Alcohol intake certainly doesn't help. Medications, we'll talk a lot. I have a few slides to show, but there are plenty of medications out there that, in my opinion, as a pharmacist in the pharmacy community, we need to do a way better job. This is more in the retail world, in my opinion. Having pharmacists talk to patients about the risks associated with all of these medications, the steroids that are out there, the antacids that are out there. I have a whole list of them. Even diuretics for blood pressure is a huge issue. It pees out your calcium and magnesium, and now you don't have, you think you're taking enough because you're on a supplement, but you're also on, 3 water pills and something for your heartburn, and you're still losing bone mineral density because you've got, 3 or 4 medications on board that are causing you to lose bone density. So we'll look at that in some more detail. And then, obviously, the focus of tonight's talk is poor gut health. So bad bacteria, bad bones. But if we have good bacteria, we should have better bones. All right, so here's where I get a little nerdy. So you can, if you want to just fall asleep for a few minutes, I'll wake you up. When we get to the treatment stage, it's a little more fun. So physiology of bone. Obviously, it gives us structure, allows us to move, provides support, right? We all get that. Gives the body function. So bone marrow produces our red and white blood cells and platelets. So we don't want to forget about that. Think of the immune system. Where do all those white blood cells come from? How does our immune system produce those? Well, it comes from our bone tissue, right? And so you've got to be thinking that inner space here, that soft bone tissue, not the mineralized part, not the outside, but the inside part of the bone. White blood cells are coming from there. Platelets are coming from there. Red blood cells are coming from there. It obviously does act as a storage system for minerals, so calcium and phosphorus are the primary minerals, but there's other minerals in this mineralized structural bone. We've got magnesium, iron, zinc, copper, selenium, boron. So there's a lot of other minerals stored in this tissue. So think of the bones not just as structure, but also as storage. So that's important too. We want to fill that up. And that's where I'm talking, to those patients that are younger, that, again, in your 20s, 30s, 40s, start loading in, at obviously appropriate amounts on a daily basis of these minerals to store all of that in there. The other important thing, I'm really jumping around right now, but to store all those minerals in the bone tissue, you've got to hang them on something. So you need collagen, you need protein. So not just taking calcium supplements every day or a magnesium supplement every day, yeah, it's great, but to make it better, eat protein, get a good quality collagen supplement so that you can hang all the minerals onto something. And it's that collagen that you're hanging it onto. So protein makes up a dense network of material called collagen. I just said that. Collagen adds flexibility to bones for shock absorption as well. So I was going to do this tonight, but there was an experiment where a professor took a bone, soaked it in vinegar, essentially. I don't know for how long, maybe overnight. I wanted to do this experiment, but you can leach all the minerals out of the bone, and you still have all the collagen left, and it won't break, right? It'll just flex. And so when we are breaking bones, we also don't have enough collagen, in my opinion. They're so brittle and frail that when we do fall, it just snaps. There's not enough collagen there to kind of hold it together as a glue, so to speak. So we got to make sure we're getting enough protein in our diet, because that builds the collagen up. Here's where I talked about bone, actually from the producing hormones side of things. So bone creates melatonin. Melatonin stimulates osteoblasts to create new bone. I'll talk about what osteoblasts are in a minute. They're just basically bone-building cells. And then another cell in the bone tissue called, same one. Osteoblasts produce something called osteocalcin. Osteocalcin, we can talk all night about it, but long story short, I just summarized here. It increases GLP-1 secretion, which, not that that name matters, but it helps to produce bone tissue. Improves insulin production, so it's actually good for if you have strong bones or more able bones, I'll say it. We have better managing blood sugar and better managing our risk of diabetes, essentially. Increases muscle insulin sensitivity. So when we have receptors now in our muscle tissue that's more sensitive to insulin, we need less insulin to soak up the blood sugar. So again, long story short, it helps reduce insulin sensitivity, which is good. And then Osteocalcin also helps to increase testosterone production. So for women, estrogen is super important, but also testosterone, especially for men too, but for women need testosterone just as well as estrogen to build strong bone. So yes, you can do it with just estrogen by itself, but in my opinion, stack the cards in your favor, get your testosterone level measured, see if it's actually low, and if it is, treat it appropriately. Here's that study that was done on melatonin improving bone mineral density. The interesting thing about this study was they only found it at the femur. They didn't find it in the spine or anywhere else in the body that they looked at. So there's limited, benefit of taking melatonin essentially. So still, we still might want to take it, but it probably wouldn't be on the top of my list, to be honest with you, from a supplement side standpoint. If somebody's walks in and they're having trouble sleeping. Oh, and by the way, they also have osteoporosis. Well, then you kind of get a 2-for-1 deal there, possibly. So, and here's just more of the same thing. The interesting part, the dose that was looked at this study, the 1 milligram didn't really do much, but it was the 3 milligram melatonin that helped build bone the best. So compared to placebo. So you got to take the right dose. Who knows if 5 milligrams would be more beneficial? I mean, there's more studies that can be done on melatonin and bone health. In my opinion, there's not really, again, from the pharmaceutical world, an advantage to do this study. You can't patent melatonin, so it's hard to find funding to, do some of these studies. Yeah.
I've heard that taking melatonin on a long-term basis for not sleeping is not a good idea. Is that false?
From a sleeping standpoint, in my opinion, melatonin. From the research I've looked at with melatonin, you don't develop a resistance to it. So, meaning if you stop taking it, let's say you take it for a year and you stop it, your body will produce that melatonin hormone again on its own. You won't suppress your endogenous production. But I'll be honest, anecdotally, majority of the patients that try melatonin from our pharmacy, it doesn't work for them. I don't know why that is.
But if it's good for bone development, why doesn't everybody take it?
There's better things out there.
Okay.
Yeah. Like if I had $100 to spend on bone supplements, melatonin would be low on that list. Yeah. So there's these two cells. One of these other take-home points is we got two cells in our body. We've got osteoblasts, which build, and then osteoclasts that resorb. So it's kind of this teeter-totter effect. We want to do both, and that's one of the things that I'll talk about with bisphosphonates in a few minutes. Is I want to always try to mimic nature as much as I can. I want to make sure my bone-building cells are working and putting down new bone, but I also want to make sure my osteoclasts that are sucking up and resorbing old bone are doing that too. Because who wants to have old, stagnant, dead bone laying around? We don't want that. So we want to keep continually, and I think that's an important part of sleeping, is that what do we do when we sleep? We rest and repair. We're not building bone like right now as I'm standing here. It's done while we're sleeping. So osteoblasts produce collagen, forming structures for minerals, so that calcium, phosphorus, and other minerals are depositing into new bone tissue. So that's what those osteoblastic cells are doing. Osteoclasts are resorbing or sucking up calcium and just kind of chewing out the old bone. I call it stagnant bone, so that new, fresh bone can be laid in its place. That's how I think of it. Here's where that gut-bone connection starts coming in. So this interaction between the microbiome and metabolites. So it's not the bacteria themselves, it's what they produce. That's important for bone tissue. So the MK7, that comes from the good bacteria in our GI tract. That's what we're looking for. Or we'll talk about this in a minute too, but it's the short-chain fatty acids that have a benefit to bone tissue. It's another metabolite of good bacteria, GI tract. Microbiome diversity, balance, and dysbiosis all have shown to play an important part in bone mineral density, strength, structure, and fracture risk. And I'll explain what this looks like in a minute. We have a test that you can actually look and see Do you have a lot of bad bacteria? Do you have a lot of good bacteria? Do you have a lot of diversity of bacteria? Well, now we can start to test that. So that's, it's a poop test. Yeah, so I'll show you that. Yeah, exactly, yep. That was our stool test. There's a lot of information on MK7 out there, so we could again spend all night just talking about vitamin K2. Take-home point for me is I recommend MK7 over MK4. MK4 is great. That's mainly found in animal-based food products. The problem is the half-life. It only sticks around in your body for, depending on the research you look at. I think I put the hours on another slide. I think it's like 3 to 6 hours. This is the half-life of MK4. MK7 has a half-life of like 2 to 3 days or something, or 3 to 4 days. It's very, so you're going to get, if you have a longer half-life of MK7, it's going to stick around longer, have longer lasting effects. I'd rather do that than have to continually eat animal-based products around the clock to help build my bone tissue. Or you can do both. Interesting thing here. So it says, I'm just going to read this. Dietary vitamin K is remodeled by gut microbiota and influences community composition. What does that even mean? So even the MK4 that we consume, our gut bacteria will take that and turn it into MK7, MK8, 9, 10, there's a whole slew of different numbers that they looked at down here, 9, 10, 11. Basically, it keeps adding, I have a picture of what vitamin K2 looks like. It keeps adding to this chain. The longer the chain, essentially the longer the half-life, the longer it sticks around, the longer the benefit lasts. And so we've got to feed our bacteria precursors from plants and food, and then that bacteria will then help to produce vitamin K2 in the MK7 and longer chain forms. So that's what I do. So it kind of goes both ways. Like we're using MK7 to produce bone tissue. We want to have good bugs to get more of that MK7 around. They also are feeding that.
Dane said your volume's still low. No. He said when it was orange that it was great.
Oh. So I should go back to orange. Usually if it's orange, I thought I was like, yeah, getting too much.
I'm sorry.
No, you're fine. Going back to orange. How's that?
Yeah, that's good.
Good? Yeah?
Can turn it down.
So yeah, next time you're thinking of your GI tract or you have a stomach ache or whatnot, just think of your intestines. They are important for building your bone tissue. A lot of critters in there going on, mainly in the large intestine too, where those short chain fatty acids are being produced, helping our skeletal system. So I just kind of broke this down. Critical interactions between the gut microbiome and our bone tissue. So nutrient absorption. So we have bacteria in our GI tract that is extracting, absorbing, and synthesizing key nutrients. It's extracting calcium, it's extracting magnesium, it's producing vitamin K2, so on and so forth. So there's just nutrient absorption and extraction from our bacteria going into our bloodstream, then going into our bones. Inflammation control. So chronic GI inflammation can stimulate osteoclast cells. Who cares about that? Well, when you have too much osteoclastic activity, if you have inflammation in the GI tract, then you get upregulation of osteoclasts. Well, osteoclasts are sucking up old bone. They can get out of control where they're actually pulling away too much bone. They kind of get misdirected, and they start, okay, all the old bone is removed. Let's start eating up new bone right away. So GI inflammation leading to upregulated osteoclastic cells that have kind of gone rogue, and we're just going to eat up some bone tissue today because there's inflammation going on. They're panicking. Hormone regulation. Gut bacteria produce, we talked a little bit about this, the osteocalcin and melatonin. That's part of the hormone regulation, but gut bacteria produce chemical signals that enhance estrogen metabolism and insulin growth factor 1. What's important with that is that with estrogen, estrogen's a delicate balance. So yes, we want to produce estrogen, but we also want to metabolize it and get rid of it as well too. So if we have dysbiosis in our GI tract, now mainly this is done in the liver, right? So the liver is metabolizing estrogen, but we need a healthy GI tract to get rid of that metabolized estrogen as well. So just keep that in mind too, that there's an endocrine component to healthy bone tissue. So dealing with insulin growth factor, dealing with estrogen metabolism. And then the last one that I talked about already, but these bacterial or bug byproducts. So short chain fatty acids that are produced mainly in the large intestine downregulates osteoclast activity. So short chain fatty acid production will then tell those cells that are eating up the old bone, or maybe they've got misdirected and they're eating up new bone. It tells those short chain fatty acids signal those cells to calm down, stop eating up the bone tissue. Everything's going to be okay. And again, those short chain fatty acids are produced by specific bugs in our GI tract. This is interesting. This was a study that was done in mice, so you got to be careful on how well we extrapolate some of this data. How's my volume now? Is it better?
Good. He said thank you.
You're welcome. But germ-free mice, so I'm not going to get into all that, but there's basically mice that are created that don't have a microbiome. It says, I'll just read this, germ-free mice that received gut microbiota, so like a poop transplant is kind of how I think of it, had increased bone formation and resorption. It goes on to say serum levels of insulin growth factor 1 increased in mice after microbial colonization, so showing that when we get good bacteria in the GI tract, insulin growth factor 1 goes up, which then creates bone formation to go up. Here's the interesting part that I thought. Antibiotic treatment of mice decreased insulin growth factor 1, which then bone mineral density goes down. So so they took that antibiotic treated mouse that we did see now an increase in insulin growth factor 1, which is related to bone health, good bone health. They supplemented it with short chain fatty acids to those same bacteria, to the mice that got the antibiotic, and their insulin growth factor went back up. So, if you're my point to this is, well, again, I'm extrapolating some of this, but if it was me, I was on a lot of antibiotics, I would look at taking a probiotic to increase the short chain, and you could do it a couple different ways. You could just empirically take some probiotics and prebiotics to reestablish your gut flora. You could even take it one step further and do the gut microbiome test to actually do the poop test and see if you have dysbiosis and to what degree. And then if you kind of fail that test, if you don't have enough good bacteria, well then we need to start figuring out what other probiotics you might want to take to fix your dysbiosis, which will then help improve your body's ability to build bone tissue back up. So just by taking an antibiotic, and maybe not just one, again, there's more studies that need to be done with this, but I've had a patient a month ago, younger gal, all through middle school and high school, she was on antibiotics for acne. Her doctor never took, and her gut is totally screwed up now because of being on antibiotics for whatever it was, 6 years, 7 years, 8 years. Yeah, and there's a lot of other issues, in my opinion, that have resulted from being on antibiotics for 6 years continuously, but yeah. I'm pretty sure we could agree that being on antibiotics for 6 years is probably not going to have helped her bone tissue. This is just another study that looked at, I've got cut off there, but basically talking about the gut microbiome and how it gets disrupted and how using probiotics and prebiotics could be a new novel treatment for treating osteoporosis. And here's yet another study, the role of the gut microbiome on bone homeostasis and its relationship with bone-related disease. So I'm just going to read this summary. It says, in recent years, there has been increasing evidence that communication between the skeletal system and the gut microbiome can influence bone health, and that the gut microbiome is a key regulator for bone homeostasis. We review the roles of the gut microbiome in bone homeostasis. In addition, the relationship between the gut microbiome composition and selected bone-related diseases is presented. It is also emphasized that a probiotic supplementation can play an important role in suppressing the symptoms of each of these diseases. And the diseases are osteoporosis, osteoarthritis, rheumatoid arthritis, diabetes, obesity, and bone cancer. So a lot of research still has to be done on this, but at least we're starting to look at it and going, hey, I mean, I think we kind of all have probably heard about how a poor gut microbiome can lead to obesity. But I don't think we've heard as much about with diabetes. That's kind of a newer thing.
Arthritis.
Yeah. So,
Osteoarthritis or whatever. I mean, don't they just say that that's old age and
yeah,
you deserve it?
You're just getting older, so yeah, you have arthritis in your joints. Oh yeah, but by the way, have you been somebody that's been on antibiotics for,
No.
I have patients come in often enough that are, we see a lot of chronic UTI patients here, a ton, unfortunately. And some stories of patients and their moms that are in nursing homes, and all these stories that we hear over the years, or I've heard over the years, of just chronic UTI, and then just give them an antibiotic, give them an antibiotic, give them an antibiotic. And to me,
Makes it worse.
it's like, I get it, like I don't want to stand here and say like we shouldn't treat the infection, but at the same time I think we should do something to offset the side effects, the negative consequences of that antibiotic. I mean, obviously we don't want to have a UTI go crazy and then you get septic and die either, right? Like we all get it, but at the same time, this information's out here, we should be doing something more about it, right? In my opinion. But you guys are here learning, so great for you guys. And now I'm getting into some of the studies that I looked at with specifically GI issues and poor bone health. So this talked about primary biliary cholangitis, so basically poor inflamed bile, liver disease, you can chalk it up that way. So autoimmune liver disease with multiple complications, osteoporosis being one of the main comorbidities, 30% prevalence. In PBC, and up to 40% of those awaiting liver transplant have osteoporosis. Pathogenesis, decreased bone formation. Well, why is that? They have decreased osteoblastic cells, decreased levels of osteocalcin in their blood. Here's something interesting too when you think of biliary, bile, things to that nature. Possible K2 deficiency due to possible impaired absorption. So if you're not producing enough bile, or I'm going to again extrapolate from this, but let's say you're a patient, you got your gallbladder out.
Just gonna ask that.
Mm-hmm. Because I started about a year ago. I try to ask patients that come in here if they come in for like, a lot of patients come in here for random things, and that's good. You know, we've kind of been known for that place of like nobody else can figure it out. Let's come to MD Customer X. They might have something. And so I started asking patients about, well, do you have your gallbladder? Like, I don't know if it's just unique to our location, but I would say half of the patients that I ask that to don't have their gallbladder out. And I'm shocked. I'm like some people are like 30, 40, 50 years old. Like oh yeah, my gallbladder, they took it out 10 years ago.
Tonsils too.
Yeah, I can tell you.
When I was a kid, didn't happen to me, but you had more than, half a dozen sore throats or whatever.
Yep.
And we're missing
Tonsils
school.
are gone. Yeah.
TNA.
Yep. Now we realize that our tonsils are important for a healthy immune system. So they're not absorbing vitamin K2. I skipped over this, but it's a fat-soluble vitamin. So if you don't have bile, I always think of bile as your Dawn dish soap. It takes the grease away, but in this case, it's a good thing. Your bile takes your K2 away. Where does it take it away to? Your blood, where it should be. Or it takes your vitamin D, which is another lipophilic or fat what am I trying to say, fat
Dependent,
dependent vitamin, fat soluble.
soluble?
Yeah.
Okay.
I needed some more coffee. Sorry. So yeah, you're like, oh, maybe I shouldn't take my gallbladder out. Right? I'd like to see a study done with patients that have had their gallbladders removed and the incidence of osteoporosis, 5-10 years later. More research. IBD, so inflammatory bowel disease, increases risk of hip fractures. So why is that? What's going on there? Again, this gut inflammation, basically, the way I think of it, is causing a whole mess of things. So this was a study done, 72 hip fractures. Now, this is not a lot of hip fractures in these patients, but compared to placebo, or I'm sorry, compared to a patient that doesn't have IBD, their risk of fracture is way up. So their conclusion of this study, the risk of hip fracture increased by approximately 60% in patients with irritable bowel disease. And then what was one of the main contributing factors? Steroid use. If you know anyone out there with IBD, IBS, and they're on steroids, and again, I'm not saying that that's wrong, but now that we know this, we should maybe consider looking at, what's their vitamin D status, how much vitamin K is in their body. Look at their osteocalcin levels. There's a lot of other things you probably should be doing.
Are you talking about like an oral corticosteroid or?
All of them.
All of them are injectables
Yeah.
or whatever?
This was probably done maybe in oral, but
Okay.
yeah.
I mean, like
But
somebody
not-
might get cortisone for their knees or something like that or
And that's
whatever.
right, cortisone shots for their knees, arthritis, right?
Mhm.
You can only get so many because what are the consequences, right? It raises your blood sugar, raises your blood pressure, it starts to steal away the bone mineral density in that joint, all kinds of not great things. Yeah, it takes the inflammation down, but it comes at a cost too. Here's just another study that was done, reduced bone mineral density in some more irritable bowel disease patients. So if you have inflammatory bowel disease, strongly suggest you start asking your doctor to start looking at your bone mineral density sooner than later. This was a systemic review and a meta-analysis in irritable bowel syndrome. Conclusion, with IBS patients, increased risk observed among patients with IBS with a pool risk ratio of 1.95. So anything above 1, you're looking at increased risk. This was almost double the risk of osteoporosis in patients with irritable bowel. So, all that GI inflammation. Again, we're not thinking of that. I'm thinking about my stomach. I want to feel better. Right? I want to stop having diarrhea or constipation or both. Nobody's really, in my opinion, are we really thinking about bone health in that patient? Usually not. Yep.
Some of it from the medication for IBS, could that also be contributing to?
Right, so the contributing factors, in my opinion, with kind of pulling this all together, medication, steroids, decreased absorption of the minerals. That's the other thing. All the cofactors, all the nutrients, all the protein, all the collagen, it's just not getting in through the GI tract, from the GI tract into the bloodstream.
In the
Poor absorption.
like the steroids or the other medications kind of attack that, and they prevent the absorption and whatever you're trying to do and throw it all up.
And they're upregulating those osteoclastic cells that are like, hey, it's party time.
Just want to
Yep.
make sure I'm
Yep.
getting the chemistry right here.
Yep. This was a study done with osteoporosis and celiac disease. So if anyone here, we do genetic testing here now. I did the genetic test. I have 3 out of 4 markers for celiac disease. I did not know that.
What is exactly celiac?
So gluten allergic.
Oh,
to
that's
gluten.
right.
Yeah.
Gluten intolerance, complete,
Yep. I would argue we all are sensitive to gluten.
Mm-hmm.
I have yet to see a study that, and I haven't looked at all this, I mean, right, how many studies are out there on gluten? Thousands, tens of thousands, so I haven't looked at them all, nowhere close, I probably looked at about 50 to 100. But gluten doesn't do any good for the bones, so I would argue like, yeah, do you really want that bread, and I'm gonna get off track here a little bit, but with gluten, it ends up being, the net result is it causes acidity in the blood. And when you have acidic blood, your body tries to buffer that out by basically making calcium bicarbonate. And so how does it make calcium bicarbonate? It actually pulls the calcium stored in your bone to make the bicarb to offset the acidic diet of gluten that you're eating, or ice cream, or pizza, or the 5 Miller Lights you have every night to go to bed and wind down, and fill in the blank with whatever acidic diet you are eating. You're drinking 5 cups of milk every day because of that you need more calcium, right? But then all that dairy is acidic. So.
And you're speaking pretty much of cow's milk, or the,
Yeah.
not
Yeah.
necessarily some of the other alternative, or sheep's milk, or.
Correct, yeah.
Or
Yeah.
goat.
Generally, overall, can have an acidic effect on the body and the blood, which then the body has to figure out a way how to buffer that out, yeah.
Yeah, I mean, the cheese, like, sheep is better than goat, but I think in some cases.
And we just don't, and my point is, we just want to go too far overboard
No.
that way with dairy. I mean, I eat a fair
No.
amount of cheese myself, but I'm also, balancing that with alkaline foods too.
Well, yeah, but I mean, and I'm not a big cheese eater, but I mean, and I make my own oat milk, or almond milk,
Almond, okay, yeah. I'm a big almond milk drinker, yeah.
so.
Not a fan of dairy, but to each their own. But long story short, if you're out there, you have celiac disease, again, just raising awareness, make sure your doc's checking your bone mineral density score. Start doing that sooner than later, in my opinion. And there's a whole scheme of things that are going on here metabolically that we can track down and trace. And what's their level of inflammation? We can measure TNF alpha, we can measure IL-1 and IL-6, these inflammatory markers. Let's start looking at them.
Is that done through blood test or
Blood
something?
test, yep. Those are all simple blood tests. They can look for all those inflammatory markers, yep. Oh, this is my favorite. How am I doing on time? What time are we at?
7:22.
7:22.
Oh my gosh. I laugh. I'm on slide 31 of 52.
Well, you're more than half.
Yeah, right. All right. I'll try to pick it up. Not too many stories. All right. Increased risk of bone fractures in patients taking antacids. So my least favorite pharmaceuticals, by far, are antacids. All of them. So I say that for multiple reasons. All the risks that are involved with them, and I personally was on them for 2 years, and it, in my opinion, darn near wrecked me. So.
And you're saying anything like from a Pepsi
I
to a
don't-
Tums to a
Yeah.
Rolaids or whatever?
Yep, to a shot of baking soda
Mhm.
mixture, yeah. Uh-huh.
All right.
All of them, all the above. Oh, I put a little animation in here. So, here's your food going on in your stomach, right? Now this is just great, like this is,
Your
wait-
stomach
wait
acid.
for it, wait for it. Oh my God, there goes this, there's your acid going up into your esophagus. I wish I could pause this, but this juncture right here, that called the lower esophageal sphincter, should be closed. Now technically, I'm gonna get way off course here, but you guys asked for it. Or maybe you didn't, but I'm gonna give it to you anyways. When there's acid in the stomach, there's a signal sent to the brain, and from the brain back down to there's a whole network of nerves here, right? That interface with all the tissue down here, it closes that door down. Right? I'm gonna say that one more time. So when when you eat food, there's acidity in here. You produce stomach acid. That sends a signal to your brain, back down to the muscle tissue here, through the nerves to clamp this door down. So when you give yourself an antacid, because you have heartburn, because it's implied that you're producing too much stomach acid, which, well, in my research, there's only about 10% of the patients out there that are actually producing too much. So the other 90% are not producing enough, or maybe they're producing the right amount. But anyways, back to my story. Acid in there, when you eat a meal, you produce stomach acid, it closes that door down. When you take the antacid, this acid goes away, so guess what? That door's open. So even in this picture here, that is downloaded from the internet, this is wrong. Because there's acid in it. If I'm assuming in this picture, this golden slop there is acid, stomach juices, that door should be shut down. So technically this patient has acid reflux. Right? They're probably on an antacid. Who knows? Probably on a PPI. So anyways. So you guessed it, the increased risk of fractures with common antacids, specifically proton pump inhibitors, because those are super, super strong drugs. Once they attach to their receptor, they block the acid for such a long period of time. They have a very long half-life. They just stick around in the body, in my opinion, way too long. So this was put out by the FDA. This was updated in 2011. But long story short, the FDA even came out and said that PPIs, we should be careful with PPIs, caution your patients that are on PPIs or even taking over-the-counter antacid PPIs, because it's likely that they're going to increase their risk of osteoporosis. So, and that was 2011. So there's a study done, long-term PPI therapy and risk of hip fracture goes way up. Now in this study, this was just a case control study, so this wasn't like double-blind, placebo-controlled, gold standard study, but they just looked at a bunch of patient data. Those that were on, not as strong of a PPI, but these are like the ranitidines or the famotidines, the cimetidines, like the Zantac. What's the other brand name for an H2 blocker? Zantac, Pepsid.
Paracet?
That's PPI, but Pepsid's a common one.
Okay.
Tagament. Yeah. Anyways, H2 blockers, not as strong as PPIs. They increase their risk of fractures, but here's where it's kind of scary. So greater than 1 year on a PPI, if their dose was, and I'm not going to get into all the details here, but less than 1.75 average daily dose, their risk went up by 140%. If they were on a higher dose than that, their risk went up 265%. And that's what they call adjusted odds ratio, which means basically comparing that patient, or comparing yourself on a PPI and then comparing yourself not on a PPI. So not compared to anyone else, but really yourself. That's what that adjusted ratio means. So that's a big number. So and scary. So if you need to be on a PPI, great. You have a GI bleed, in my opinion, there is certainly a time and a place for PPIs. But even in like the package insert for antacids, I think it says something to the effect of, don't take for more than 14 days unless consulting your physician, blah, blah, blah. I think in the prescription strength PPIs, it might be up to 12 weeks you can take a PPI, might be in the drug packages, or 8 weeks. It's not years, we'll put it that way. And so, again, these are way overprescribed in my opinion, and there's a ton of risk associated with PPIs, and here's another risk factor for antacids. PPIs is osteoporosis. So. Proton pump inhibitors and fracture risk. In conclusion, PPIs suck. They will not allow you to absorb efficient amounts of calcium and vitamins needed for bone tissue. That's basically what I'm going to sum that up for you. Here's another update. This one was done just recently, last year. This was published in 2022. Proton pump inhibitors in bone health. It says, consequently, long-term PPI use should be prescribed only in cases of strong, validated, and recognized conditions. So I have patients that have come in here, I am not exaggerating, that have been on PPIs for 20 years. I've had patients that have been on them for 10 years. I was on them for 2 years.
But if you go to the doctor, at least, that's what I did, and, brought this up, and they just poo-poo it and say, no, I have patients on for 20 years, they're fine.
No, they're fine, yeah.
So they just poo-poo it.
The research is out there, like I'm not making this up, like it's there. It's
Right.
proven over and over and over again.
And they just keep-
The problem is it's so damn hard to get off of these drugs because it suppresses the acid to so much. I'm gonna go back to my picture here. You suppress this acid so much that these cells that you've blocked with the drug, imagine all these pumps in here that are trying to push acid to dissolve your food. you've locked them up with the drug that the body recognizes something's wrong with that pump. So what does it do? It builds another pump. And then it builds another pump, and then another pump. You got like 3, and they've done this. They've taken cross sections of the stomach wall and seen how these hydrochloric acid pumps are lined up behind the one that's blocked. And so when you get off of this, and you cold turkey it because you're sick of it, now instead of having one pump go off, you've got 2, 3, 4, 5 layers of these, and you're physically addicted to the drug. So you got to
What's the alternative?
You have to taper off with them. The alternative, I'll have to tell you afterwards.
It works.
Come see me.
Yeah, it works.
Yeah.
Do what he did.
Yeah.
'cause
I did it myself. I've got a whole protocol for that. Yeah. You got to do it intelligently, and yeah, there's a way.
Step by step.
I know you've had seminars.
Yes, yep. But so, and for those watching on YouTube tonight too, call the pharmacy tomorrow. Operators will be standing by. Physiological role, let's see, affected by gut, microbiome. We talked about this, but increased risk for autoimmune, diabetes, obesity, cancer, and osteoporosis, all affected by poor gut microbiome. So these are the ones I've talked about in the past, right? I just added to this slide, like autoimmune disease goes up when you've got bad bugs going on in your GI tract. Diabetes risk goes up because you're not producing insulin and all this kind of good stuff. Or being sensitive to insulin. Obesity goes up. You know, what is it? Something like, I forget the number, 70–80% of our immune system resides in our GI tract. So if our immune system, if our bacteria is crap, then our immune system is crap. If our immune system is crap, you know, cancer in a very simplistic term is nothing more than an impaired immune system. Because we all have cancerous cells, and the immune system should just clean out a bad copy, clean out that bad cell. Well, if the gut's screwed up and the immune system of the gut is screwed up, your risk of cancer goes up.
There's a reason they call it the second brain.
Yeah, yeah. There's more nerves in the GI tract than there are in our head.
Yeah.
So we should be thinking with our guts more than our heads. Yeah, that gut instinct is a real thing.
Yeah.
It really is. Yeah. Well, yeah, intuitively, I think we all know that. So here's that test I was talking about. This is the microbiome test kit. We partnered with Standard Process to do this. Long story short, it takes a while to get back though. They are literally like taking all of the, their DNA sequencing, I wouldn't say all, but a lot of the bacteria in your GI tract to figure out what bugs you have and all that kind of stuff. So fascinating kit. I highly recommend it for those that like, again, a lot of antibiotics, any kind of GI issue, long-term PPI use, so on and so forth. So, yeah, not that, if you're in perfect health, don't worry about it, but here's what that report looks like. You got diversity. This is actually my results. So I scored a 3 out of 10. I failed this test miserably, but diversity sucks. Phyla balance sucks. I was a little bit okay. I had 4 out of 10 for beneficial bugs because I contribute that to taking my probiotic, but it still wasn't enough. My pathogenic species, I didn't have a lot, so I actually didn't have too many bad bugs going on. So I guess I got a B on the pathogenic section. So, yeah. I mean, it's fascinating stuff. I have a whole seminar just on that. So how do we, here's the risk factors for so how do we keep our good bacteria good and keep the bad bacteria away? So reduce your stress, get rid of toxic chemicals, get rid of all the medications that are gut disruptors. So patients that are on NSAIDs chronically. I remember in the pharmacy years ago, we would dish out ibuprofen, 900 milligrams? No, 600 milligram tablets. I remember this one patient, she must have had like RA or some kind of arthritis, and she took 3 of those every day, every month. It was like, I think back on it now and I'm like, holy crap, that's awful. Sorry I wasn't part of that. I mean, I didn't know any better.
Oh, that's what you were taught.
That's what I was taught. You have arthritis, load you up with NSAIDs. Just, if you get a GI bleed, it'll look like a tarry bloody stool. And then we'll fix you when you get to that point. sick care, not health care is what that was.
Yeah. Well, you know, everything we take from standard pharmaceuticals has a side effect. And then they give you another one to combat that
Cover
side
that up.
effect.
Yeah.
And then they give you another one because that's another side effect, and that's why you're always on
So
15 or
now-
20
I like
prescriptions.
the one where they're prescribed NSAIDs, right, for some inflammation, and then to help offset the GI upset because of all the NSAIDs, what do they give them? A PPI. We do that in the hospital all the time. Oh, well, that's great. You're welcome. Yeah. Oh my gosh, how bad is that? Emulsifiers, dyes, preservatives, that can wreck the GI tract. Food allergies, food sensitivities. If you don't know what your food sensitivities or allergies are, go get them tested. That's what I did here as well. We offer food sensitivity now. You can test 176 foods and find out, like I was sensitive to carrots, never knew that. Came back with apricot, arugula, some weird stuff. But if you don't test, you don't know. Gluten's kind of, I mean, if you don't want to spend the money on the test, just avoid the most common allergenic foods that are out there. What are those? Gluten, dairy, soy, you know.
Oh, yeah.
Those are the key ones.
Corn.
Corn's another one. Lifestyle recommendations. Eat a healthy diet, talked about that already, but get your basic core nutrients in your body in the first place and have a GI tract that can actually absorb them. Get sufficient safe sun exposure to get your vitamin D or supplement with it. Ensure daily movement and exercise, including strength training and weight-bearing activity. I didn't put any slides in on this, but again, you can't walk yourself out of osteoporosis. You have to do, some type of water aerobics, something to push on the bones. Because if you're not going to push on them, you're not going to stimulate them to suck up all those nutrients you're taking. If you're going to spend, $100 a month on collagen and vitamin D and vitamin K and selenium and boron and calcium, magnesium, if you're going to spend all that money on your bones, you've got to make sure, just because you put them down your throat doesn't mean they're absorbing into your bone tissue. You've got to push on your bones. That will stimulate to suck up those nutrients. Can't stress that enough. Got to be weight bearing, strength training, exercise, as well as aerobic. But for bone health, it's got to be weight bearing. Don't smoke. Limit alcohol. Eat protein. Most of us are not. I was at a seminar lecture on Saturday in Chicago all day. It was kind of miserable, but got to keep learning this stuff, right? It's just not going to osmose into my brain. I was always thinking we had to eat about a gram per kilo of body weight. It's more about like 1.2 to 1.3 grams. So you got to eat more protein. Don't over-protonate yourself. Is that a word? Protein. Whatever. I just made that. Sounded good, right?
Sounds good.
Don't eat too much protein because then it'll then spill over and make sugar, and then that's not good either. So.
I have a friend who visits me from Japan, and she jumps. She said over there they're taught to jump for their bone strength.
Yeah,
And that
that was-
astronauts, when they come back from gravity, they're on that machine.
Yeah.
So is that good enough?
I mean, if you're jumping, right, you're building
Yeah.
bones here in your hip, but like I'm thinking the slip and fall type of thing. I want this bone to be nice and strong, so you got to do something here
Gotcha.
as well. Yeah. So jumping, yes, it's a start, but find somebody that knows how to exercise properly and safely and do that. Yeah. I'm not that guy. Yeah. I'm going to just tell you to do lunges or something. Therapeutic strategy. So vitamin D3, K2 in the form of MK7, calcium, magnesium, collagen. That'll help build bones. Those are the building blocks.
And doesn't D benefit from vitamin K as far as absorption? Or is it the other way around?
So
There's a calcium that I'm thinking of.
So let's talk about that. So what does vitamin D do? It brings, it brings calcium in. I think we all kind of know this. It brings
Yeah,
calcium into
calcium.
the GI tract. If you just take calcium, it's going to stay in your GI tract and you're going to get constipated. If you have vitamin D around, it's going to pull the calcium into your blood. But the calcium doesn't really know where to go. So it ends up depositing in your arteries. And they've actually seen this on studies where they'll take women in nursing homes, put them on just calcium and vitamin D, and they'll do a chest x-ray, I don't know what the time frame is, let's just say a year later, and their aorta will show up on chest x-ray because they've calcified it too much. There should be 0 calcium essentially in your smooth muscular walls of your blood vessels. But they've calcified these women, so over-calcified them to the point where it's all in their arteries. Like,
No.
you basically just created atherosclerosis. So, vitamin D brings calcium into the blood. Vitamin K2 activates, or basically hand delivers that calcium through osteocalcin. I'm getting off track here a little bit, but the K2 stimulates another protein to grab onto that calcium now and deliver it to the bone tissue.
Okay.
The other thing about vitamin K2 though, I'll get ahead, but it'll take the calcium that deposited in your blood vessels and actually pull it out of there and put it to your bone tissue.
Okay.
Yeah. So.
I knew there was some kind of synergy there.
Yep. So you need both.
Yeah, you need both.
You need D to bring the you need vitamin D to bring the calcium in, you need K2 to drop it off at the bone tissue. Yeah. So I think I just said all that. Make sure you test your vitamin D3 level should be above 50. It should be between 50 and 70. And usually you can't. I was at this seminar that was I was at in Chicago. There's a story about this nude beach where the host of the seminar, I'll call her, the MC, and she was telling me, she's a doctor, she was telling us a story about these patients in her community that they don't even have enough vitamin D in Florida, in the hot part of Florida, the south part of, yeah, anyways. So my point is, you're not gonna get enough vitamin D by sunbathing. Yeah, it's just not gonna happen,
I do. I don't.
in my opinion. So I would supplement. Here's that K2 and bone mineralization. So it activates, here it is, MGP, matrix GLA protein, which in turn pulls calcium out of the vascular wall, which is what I just said. It also activates osteocalcin, leading to the binding of that calcium and dropping it off at the bone matrix. So you got 2 different mechanisms here. Stimulates osteoblasts, which again, blasts are building, so that's a good thing. So you want to stimulate osteoblastic cells to lay down new bone, but you still want osteoclasts to pick up the old bone, recycle it, lay down the new stuff. You want that constant repair. Talk about that.
Is MK4,
It's good.
is MK4 brand of K2 or what? how do you-
Yes, so MK4 and MK7 are just subcategories of vitamin K2.
Oh.
So they're both vitamin K2. MK4 doesn't last as long in the body, so it only lasts for about 3 to 6 hours,
Okay.
where MK7 is, what did I say, 72 to 96 hours.
Huh.
So you can, yeah, you can get enough, I would do, let's just make it simple. I would do MK7.
Yeah, but if you like buy a bottle of or a K2 in the
You gotta,
Walmart, in Walmart.
you gotta see which one it is.
Oh,
It's
it will
got-
actually say on there what it is?
Yeah,
Yeah.
it does.
Oh,
Mhm.
okay,
Yep.
didn't know that. Thank you.
Yep. Added benefits of K2 besides building our bone, so improves, we just talked about this, improves arterial elasticity. So there's a bunch of cholesterol here, but there's also a bunch of calcium here, and that vitamin K2 will pick that up through, what cells did I just say? Right here. The matrix GLA protein. Vitamin K2 will activate that protein, pull the calcium out of your arteries.
Or the plaque. You mean
The
or
plaque,
the-
yeah. Well,
Or the calcium.
the calcium,
Okay.
the calcium plaque,
Okay.
to be specific.
Okay.
Mhm.
And then does it help deposit it into the bones?
That's right. Hand delivers it.
Okay,
How cool is that? Yep,
very cool.
yep, I like that.
Well, yeah, I mean, we're not losing the calcium, we're
No,
not causing, the
Another
shrinking
problem
of,
down the way, so, yeah.
the shrinking of our blood vessels and heart
Yeah.
attacks.
Yep,
It's getting where it's supposed to go.
nice and flexible and smooth, yep, that's what we want.
Yep, it's going where it's supposed to.
Yep. And then improves our inflammatory response, promotes muscle relaxation, supports nerve function, and increases mitochondrial function. All great things, so.
How about blood pressure? Does it
I
have any
didn't,
benefits?
I didn't see that, but I would argue if this is going down,
Yeah, I
and
would,
these are more flexible, you're probably gonna lower
yeah,
your blood
I
pressure.
would think it would help somehow.
Yeah, it's not gonna hurt it, you can say that.
No,
Yeah. You're not gonna become hypotensive with too much vitamin K2. Magnesium for bone health, we normally think of calcium, calcium and vitamin D, calcium and vitamin D. I want you to start changing your mindset, starting right now. It's not calcium and vitamin D, it's magnesium and vitamin D, and K2. Because we get enough calcium from our diet. And if you have enough vitamin D, you're gonna pull enough calcium out of your healthy diet. So magnesium activates vitamin D. So most of us are magnesium deficient that aren't supplementing. I think it's something like 50% of the US population is magnesium deficient. We actually need more magnesium, but we need to be taking the right kind, like a chelate. Don't take magnesium oxide, in my opinion. That stuff is crap. It's going to cause you to not crap. It's going to cause constipation for you. So you got to take the right source of calcium. Well, here it is. So salt form is important. So if you have heart issues, you're going to take magnesium taurine. If you have issues with sleep or anxiety, you're going to take magnesium glycinate. If you have poor bones, you're going to do magnesium chelate, or you're going to eat a lot of healthy vegetables that are rich in magnesium. And a neat thing about magnesium, there's a lot, we could do a whole talk on magnesium, but it's a natural calcium channel blocker. Talking about blood pressure before, so there's another drug class of, what is it, diltiazem? What's the other calcium channel blocker? Diltiazem, I keep looking at Emily. What's Norvasc? Amlodipine, another calcium channel blocker. Well, guess what? And so what is it doing? That drug is blocking this calcium channel, right? Calcium channel blocker. So if you block the calcium channel, you need calcium for that smooth muscle that muscle around here to contract. But if you block the calcium from getting into the muscle tissue here, then your blood pressure lowers because now it's not as tight anymore. Well, you can just take magnesium to do that. Why do you need a drug? It's a natural calcium channel blocker.
That's because the pharmaceutical companies
Yeah,
are
but
making money on it.
Yes.
You can't patent magnesium, that's right.
Yeah.
There's no money involved. We
There's
just
only
wanna
money in giving you a pill and then another pill.
keep sick
Because now
people, we're just gonna keep sick people around longer.
Yep.
So what if you have both of those? Is there anything where you have sleep, anxiety, and bone issues? What do you do?
What do you do? I would, yeah, you have to take more than one magnesium. Yeah. There is a reactive magnesium that, there are some companies out there that will make a blend of magnesium, we'll put it that way. I'll leave it at that. Yeah.
Do you have things?
Mm-hmm. Yep, yep. All right. Probiotic, prebiotic. So if you have a long history of antibiotic use, I would encourage you to, again, either take a probiotic or prebiotic or test the bugs in your GI tract. And then treat based on what those results are. Any kind of history with IBS or IBD, I'd recommend taking a probiotic, prebiotic. We're not going to get into like which kind, how much, we'll be here all night. History of a PPI. I would strongly encourage you to get on prebiotic, probiotic. Because the other thing, besides blocking the stomach acid, is it screws up the whole pH of the GI tract, and then it causes dysbiosis of the GI tract. So not only does it, again, block the acid, which blocks the calcium absorption, but it also screws up the bugs in your GI tract. So it screws up your body from getting the core nutrients. Oh yeah, but then by the way, the good bacteria in your gut, well, we're gonna kill those off. Because we've screwed up the environment so much. And then good bacteria needed for proper metabolism of K2. That was one of the earlier slides in there, that when you consume K2, there's the different forms. You have good bacteria in there that'll help produce those longer chains and help it to stick around longer in your body. So I showed this slide earlier on. But so my point of putting it up here again is we need good bugs in our GI tract to build good bone. So yes, we can do the magnesium and the K2, the D3, and collagen and all that other good stuff, but just don't forget about the bugs.
What are some of the short chain fatty acids? I mean, I know what a medium chain one is. It's coconut oil.
Yes,
Coconuts.
that's a good, yeah. So you could, I would consider like MCT oil, medium chain triglycerides. What do medium chain triglycerides break down into? Short chain triglycerides, called short chain fatty acids.
Okay.
Coconut oil.
all right,
Or MCT oil.
okay.
Yep. Or just good bugs, good bacteria, good probiotic that we're all producing short chain fatty acids right now. All of us are. We wouldn't be here if we weren't. But yeah, short chain, like medium chain triglycerides, coconut oil, that's good sources. I talked about this already, but just to stick it to big pharma just a little more. Drugs that affect bone health. Bisphosphonates, so calcium, magnesium. We talked about antacids enough, but look at all it. Inhibits calcium and magnesium absorption, zinc absorption, iron absorption. PPI, same thing, calcium, zinc, and iron absorption is impaired. ACE inhibitors inhibit your body from getting zinc. Potassium-sparing diuretics, so like your spironolactones of the world that I have patients come in every week on spironolactone for acne, especially the younger women. I'm on spironolactone because I get pimples. So maybe you shouldn't be taking spironolactone for 20 years for your pimples. We could, if you really want to get rid of your pimples, it's probably dysbiosis. You probably have bad bacteria, among probably other things. But if you still want to take your spironolactone because of your acne, we make a spironolactone topical gel. So it doesn't have to go through your entire body. Just put a real thin layer, minimize the dose, still get the benefit, and just rub it on your face, rub it on your pimples. And then you can keep your calcium and magnesium in your bones where it belongs.
What are ACE inhibitors?
Like blood pressure pills like lisinopril and enalapril, yeah. And then synthetic estrogen, so like all the young women that walk in here on birth control, or even sometimes not so young women in their mid-40s and they're still on birth control. And I'm not saying that's wrong, right? What I'm saying is know the risks and then do something about it. So again, because these are screwing up your calcium and magnesium and your zinc and your vitamin D. So it's not helping it. So in summary, the GI tract has many functions that go way beyond digestion. I think we all kind of knew that, but just state the obvious. The microbiome is a diverse ecosystem. We still don't know. We probably know 1% of what we should know of the ecosystem down there, but it supports the body in many, 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 many different ways. The microbiome is diverse with low levels of pathogens and inflammation. Eating a healthy diet, maintaining low levels of stress, using a targeted supplementation process can help support and maintain a healthy microbiome. Building bones is much more than calcium and vitamin D. So again, magnesium, vitamin D, K2 for sure, and collagen, and lifestyle. Gut inflammation can lead to bone destruction. So again, if you have chronic GI issues, chronic inflammation in your gut, I'd be thinking more, obviously fix the immediate issue, but also be thinking bone health. And check your medicine cabinet for bone destroying agents, even the OTC stuff that's out there. They're selling billions and billions of dollars of this stuff. So somebody's buying it, right? It's not just going in the trash. So now what time is it?
7:53.
Oh, not too bad.
7:53.
All right. I'm gonna shut off all of that equipment, and then the real fun's gonna start. Then we can talk about anything we want to. It's not being